No, I then went and a few months later and went up to Scotland to one of my great colleagues, Nicola Willis, my esteemed colleague, who's done a lot of Facetite and Necktite, and we were doing another workshop, and again I volunteered to be the model that day, and I had Facetite. So again, another thing, my body type, I tended to put a little bit as I got older. A bit of fat on in the neck, which sort of removed my definition, made me look a bit sort of like a bulldog neck, and so again I wanted a little bit more of a definition of my jawline, maybe get rid of some of that fat, and so I had Facetite, which is effectively face Necktite, and again Nicola managed to get, there was obviously much less fat in the neck, but there was 30 mils of fat came out from the neck. And as over the last 3 or 4 months, I've noticed a gradual tightening of the skin in my neck and along the jawline. It's given me a little bit of a more youthful look, I think, and it's quite interesting because a lot of my patients I've seen for a long time are coming back saying, "Wow, you look great. What have you had some treatment?" And clearly they're picking up on the fact that there have been some benefits there. So that was a very positive outcome as well. It's a much simpler procedure, Facetite. It's a much quicker recovery than from BodyTite. So I literally had quite a swollen face and neck for a day or two, and I had to wear a compression garment for the first 3 days just to sort of support the tissues. So much quicker downtime, but I was back to work within 2 or 3 days. I was actually lecturing on day 3 at a conference, doing a presentation, and nobody noticed that I had a slightly puffy face, so by day 3 I was fully back at work without anybody noticing I'd had treatment. So that was quite exceptional. I was prepared to have to own up and say I'd had some treatment, but anyway, so it really positive outcome. It's such a simple treatment, Facetite and Necktite. I certainly would never have considered them a surgical facelift or neck lift or anything as drastic as that, and it just is a treatment that's very quick recovery but fantastic outcomes, really. Oh sure. I mean, any treatment I have, I can barely take a day or two out of my schedule for leisure time. So any treatment that puts me out of action is a no-no, really. So, and I think that's probably the same for many of my patients. Really, we've all got busy lives and we want to get back to normal as quickly as possible. And so these treatments are ideal for that.